Welcome to High Tea with Grace, where we spill the tea on HIT. I'm thrilled to be here at the ViVE Conference, interviewing the industry's greatest leaders about trends happening in the space. So tell me, who are you and what do you do?
Thanks, Grace. I am so excited to be here. So I am Camille McWhirter. I am the VP of Real World Data, Clinical Trials, and Registry at Omega Healthcare. So big conglomerate that's typically a revenue cycle management company, but my division focuses specifically on real world data, services, cancer registry, all the important topics to help advance research.
Awesome. I love to hear it. So what trends are you hearing about in the ViVE hallways?
Oh my gosh. So we've got lots of AI, of course. But let's pause on that and come back. I think that's an absolutely important topic. But one of the things I wanted to talk about was, we all have these fabulous wearables.
Yep. I
Okay,
love it.
all of
Tells
these,
me to stand up.
yes, absolutely. I mean, all of this amazing data that that is out here in the market, the RTM, so remote therapy monitoring, all of this extra data. And what are we doing with it? An explosion of data in our world, in this data world, but it is primarily unused. It's unstructured. It's kind of a mess. So, a lot of these conversations this week that I'm hearing is, how do we clean up with all of this explosion of data? Aside from messy data, which I already sort of talked about, is the decentralized trials, clinical trials that can be in multiple different arenas, such as virtual care, rural health facilities, and the explosion there. We really need to focus on that because most patients are located in community or rural settings, and they're not getting into clinical trials. It's really the same patients from academic medical centers that just keep on enrolling into these trials. And, we really need to represent all patients, women, Latino, all of
Absolutely.
these
That makes
different
so much sense.
disease
And I
states.
mean, and patients and caregivers are begging for decentralized
Yes,
trials. They're saying we want to participate in clinical
yes,
research as a care option. We
yes.
want to be doing this. And so it's absolutely interesting to hear that at like a health system trade show, there is talk about what's happening with clinical trials. How can health systems support this decentralized clinical trials and clinical trials even through their systems?
Yeah.
Now tell me, I'm very interested about what's happening in women's health care and
Yes.
research right now.
Yes.
What are some things that you're tracking in the space?
Well, it's been amazing. And really in the last, let's see, probably 3 to 4 weeks ago, I went to Washington, D.C. to listen to a briefing on women's health research. And it was astounding how much, or how I will say archaic, some of these different stats are. But I'm pulling out a specific stat because in 1986, the NIH released a policy that would only encourage the inclusion of women in clinical research. That doesn't mean they had to. That doesn't mean that each and every facility, really needed to focus on that. So fast forward to 2016 is when the NIH finally established the SABV policy, which is sex as a variable, which requires women in these studies. So, for example, Alzheimer's is highly prevalent in women, but all of the clinical research concluded more men than women.
Wow.
So it doesn't, it really didn't make sense. So I hear a lot of this week where, they are including more and more women just because of these impacts. But I'll read to you if you're interested in a couple stats, because I think it's super important to know. Up to 20%, now these are just some women's health statistics, but up to 20% of coronary events in women occur with no known risk factors.
Wow.
38% of animal studies researching strokes use females, although these conditions occur more often in women. Twice as many women as men suffer from depression. And this is another big topic that, we're hearing out here today and yesterday, but it's the leading cause of disability in women. This is a big stat, and I have some family. This is a more of a personal stat, but women make up 46% of lung cancer deaths.
Wow.
But only 15% of the 2019 NIH lung cancer budget went to women-focused research. It's very frustrating. So last stat here I'll mention, but women make up 80% of healthcare decisions, yet their bodies remain drastically under research. So
Absolutely. It seems like, well, of course it's under research. There wasn't
they
even a
weren't even
protocol
considered.
for research
I know.
until recently. It's really
Yeah.
fascinating stats.
Yeah.
Thank you for sharing with us.
Yeah.
Now, while my
Thank you.
listeners love to hear about what's happening in the industry and trends in the space, they also love to learn from women leaders like yourself about what drives you. So tell me, if you could give your younger self a piece of
Oh my gosh.
advice, what would
Yes.
you tell her?
I thought about this a lot, and I think that is so important. Do not hide your passion. That is what I would tell my younger self. I was always so passionate about healthcare. I believe in this system, and I believe we can grow, and I believe we can get better. You know, I know there are interoperability issues, and I know there are clinical research issues, but I would tell myself, don't be quiet, stay passionate. And for many of the women out there who suffer from imposter syndrome, get a buddy, talk it out, and wipe that stuff from your head.
Men aren't doing it, so you need to
No,
really take
no,
charge of your
no.
own strengths.
We are absolutely taking over, and that's what I would say.
Well, thanks so much for joining me
Thank
today.
you.
I love learning from you.